The topic is role of artificial intelligence in asthma care. Our speaker is Professor Bassam Mahboub. Professor Bassam Mahboub is a consultant internist, pulmonologist, and clinical immunologist who did his residency training program at the University of Toronto and in Vancouver, Canada. Professor Mahboub works at Rashid Hospital. He's also a full professor of medicine at the University of Sharjah as an adjunct professor. And he is famous for trying to use artificial intelligence in healthcare in general. Actually, he won the most innovative employee in the government of Dubai this year and was honored by Sheikh Hamdan bin Mohammed bin Rashid for this distinguished award. We were very happy with this winning for the respiratory and allergy clinical immunology field in UAE. He continues to be active in translation and clinical research. He has authored more than 90 peer-reviewed journals and books. And today he will shed some light on the role of artificial intelligence in asthma care. Bassam, the floor is yours.
Thank you. Thank you. Thank you very much. Right. So first of all, thank you very much. And I am glad to see this first UAE Allergy Immunology Conference. Back in 2008, probably we did the first MENA conference for allergy immunology, and it was amazing. And then for some reason, we were kind of focusing mainly on pulmonary diseases. And I'm glad that Mohammed and his group are trying to take the allergy immunology back to the picture. I think the way the healthcare is going, we need to do a lot of understanding of how the immune system works, be it from the asthma allergy or be it from what's happening in the COVID. And there is a lot of, or a wealth of knowledge within the immune system that we should be familiar with. How many minutes do I have for this talk? 15 minutes. Good enough. So for whatever reason, I was reading Hamlet. I didn't read it when I was young, but I was reading it. And some of those difficult words where Shakespeare is saying that brevity is a wit. So, so being smart is just talk little, and I will try to do that. So this is the editorial that got published 3 days ago, and I was the first editor on this. And this is a special issue on Frontiers of Medicine that I led, and we made it to be on biomarkers of pulmonary diseases and artificial intelligence. And in the editorial, I started by saying when biology meets math, and this is exactly what is happening. There is a lot of data coming out of the biological system. We, in a human mind, cannot navigate, and we need a computer to look into patterns, because we as a human, we get bored, we get distracted, we hate to repeat things always, and we might forget things. But computer, although they don't have the feelings, they don't have the empathy and sympathy, but they love things that has to do with repeated things. They love to look into things that it repeats itself to tell you what is common. So in the editorial, Rafat, Mahmoud, and I are trying to tell you that probably if you look to biology through the eye of math, you will be seeing different things. And this is the main message through this talk. So first of all, this is using a model to tell you if you give certain clinical parameters to a computer, whether the computer will tell you which COVID is going to be severe. The day before yesterday, I was going through this data again with Khalifa University because they are our partners now. And we are trying to find out what else deeper into this clinical data now after Omicron will tell us which patient will be severe or not. So from this data, using AI, we were able to say that probably if age is high, if you have renal disease is a big problem, if your ferritin is high, and if you're started to use a steroid initially, these all red flags that the computer told us to look at. Now we're looking at the different things. We're looking at the vaccinations plus other parameters. So when we're done with this data and to be published, probably I will share that with you. One of our master students, she's a master in computer science. She came and she convinced me through some mathematical modelings that the way we talk on the phone could be translated into a breathing and lung function using a mathematical equation, which we used, and we tested this model among 150 patients, where if you use Android or iPhone and you talk in a certain way, the way that you breathe through the phone could be translated into lung function, and this lung function could predict your spirometry, something similar to 80 or 85% to what would you do in the normal portable spirometry. Further into this, if you have a smoker and you think that he or she might be having lung cancer, it'll be very expensive to do CT scan for all these patients, and maybe X-ray will be fine. But the problem with this is X-ray is not good in predicting little nodules that you do something about it. So what happened if you go back and you learn, or sorry, you teach the X-ray or the computer, this node, I saw it in the CT scan, but I didn't see it in the chest X-ray. Can we go the back way and find out what are the things that the computer will look using the little megapixels, enlarging the X-ray and find out these little nodes? And in fact, it does. If you train the computer, so we use something like 5,000 X-rays to teach the model or to come up with a model to teach us how to look into this. And the specificity was high. The sensitivity was higher than a human eye, but always, human eye is good in the final diagnosis. So computer is good in sensitivity, less good in specificity. Human eyes are superior in specificity, inferior in sensitivity. Moving on, a day before yesterday, I was invited to give a talk about issue, totally talking about using electronic method to monitor lung diseases. And this is the way. So now most of the inhalers will be smart inhalers. So we will know when, how, at what time we use inhalers, and we will be able to predict whether a patient is lying or not, and probably they are, about using inhalers. And we will have a better way of predicting asthma, especially if we use something like monitoring an ACT test, monitoring a peak flow, and monitoring self-reporting symptoms, and putting all this together to come up with, you know what, most likely this guy will have exacerbation in the next 2 or 3 days, especially the weather is going to change and it's going to be windy or something. By the way, in 3 days, we are going to have a windy days, so you will be getting more consultations. So, but this is what you give to the computer and be able to predict asthma. Now, there is something called CNN, which is not the news network, but this is called convoluted neural network. This is the way, and without getting into the details, this is the way the computer using these informations to come up with modelings to be able to navigate the data. Focusing into what's important for this talk is using AI for immunology. If you get the rich and big data of the cells, along with its biomarkers, along with its inflammatory markers, and you give it to a computer, they will be able to tell you which cells most likely will work. Like in this exercise, they were looking at autoimmune disease, and they were able to find out which cells, like the T regular cells or the CD4 or the CD8, which ones are more likely to be presented in this disease, even without the computer knowing what's going on with that patient. To make the picture easier for you, we use the computer to give them things about the cells. It will tell you which cells most likely it will work, but it will also tell you this cell's also going to be high in other diseases. And this is the beauty, because the way that we will be explaining disease, we will not be calling it hypertension. We will not be calling it asthma. We will not be calling it cancer. I was talking to Ashraf al-Zaabi about the JAK inhibitors, and I was just making fun. There is a song called Hit the Road Jack for Ray Charles, or just to tell him that being able to explain disease through pathways is the way to go. And very soon, we will not be talking about asthma, we'll talk about type 2. And type 2, it's not asthma. Type 2 is asthma, rhinitis, atopic dermatitis. So we will be explaining disease according to pathways. Same way for hypertension, same way for diabetes. So the computer will be telling you, okay, these markers are high, but also these markers, you might find it in another disease. So make sure this asthmatic patient might be having something like cancer. We just sent a paper yesterday. One of my PhD students were looking at what happens if you have severe asthma for a long time. Did that make you more likely to develop lung cancer? And actually, there is some signals, again, by using AI to navigate the big data, that if you have certain markers for severe asthma, most likely these markers will be moving from remodeling inflammation to DNA cell repair and give you a chance to develop cancer. So watch for these things. So the point is, this is not something that a human eye or a human mind can be able to navigate this. You have to put all this big data to give it to a computer, where they will give you red flags for patterns. And that's what the computer is good at. Now, we're using now this also. This exercise was done to predict outcomes of vaccines from influenza. Guess what people are doing it now? They're trying it for COVID. We are trying to know why some people do well with the vaccines and why people are not. I took my third Pfizer vaccine 2 days ago. I was visiting Abu Dhabi for some reason, and I stopped by one of those tents and I took it. So everybody warned me, if you didn't get sick in the first dose, you might get sick for the third dose, and definitely the third dose, you will be sick as a dog. Nothing happened, alhamdulillah, so far, except from the localized pain. But I know people who really felt very bad for 2 days. So does that mean anything? Does that mean that I'm less immune to those ones? We don't know. But we had this exercise with influenza, and we are doing it again now with the COVID. I mean, not me, but there will be other people. But we are trying to predict how different people are reacting to the same vaccines. And we're looking at IGRA, T cells, and we're looking at B cells giving the neutralizing antibodies. Now, moving to artificial intelligence to use immunotherapy. This is immune therapy for cancer, not the allergic immune therapy, the desensitization, but I guess we can apply it. But in this model, people looked at pathology, because instead of a pathologist sitting there looking at 50 slides, all normal, and one of them will be abnormal, the pathologist will be really, really bored. So we are using this, I mean, not we, but people are using this to say, okay, this is how the computer will tell that this is a normal tissue, only flag the abnormal. So again, talking about sensitivity, specificity, and give it to the pathologist to look only at the abnormal ones. Then we're using it also for radiology, as I explained before. And then this is the way we're trying to approach cancer. We are trying to approach cancer using artificial intelligence, from detecting to radiology, to looking at the slides, and also to come up with omics of the biomarkers of the tumor itself to tell me which pathway of the treatment could be used. Now, I will just stop here for 1 second to say this is extremely important, because you don't want this to be commercialized. You don't want the AI to tell you to use X company's treatment or Y company's treatment. And this is where the ethic dilemma about this. You want this to be totally robust. You want it to be totally, as they say, vendor agnostic, drug agnostic, where it will give you what is the pathway without telling you. So it'll be nice to take a biopsy from atopic dermatitis without telling me I have to use Pfizer JAK inhibitors or Sanofi dupilumab. I only need to know the pathway. I only only need to explain disease based on pathways, based on what the computer can tell me from a big data of omics. Now, I talked about this a lot, but this is just to show you the amount of the publication about omics. It's just going, it blows your mind. This is the way we are going to describe a lot of the disease. So if you're not familiar with many of the jargons that I have used, it's not to show off. It's not to show you that I know, because we just have to go and learn about it. And I am still learning, and probably we should all be learning. Finally, last but not least, just for the fun, Mike Zuckerberg talked about the metaverse. They are changing the word Facebook to a metaverse. And this is the way that we will be. So instead, probably, I talked to Mohammed Abu Zaqo yesterday. I said, probably, I don't know whether I'll be able to attend physically or not, because I have some commitments. And then he said, well, it's better to come. And he's a dear friend. So I said, okay, fine, I will just make it. So probably next time, it won't be me here. It'll be a hologram of me sitting here with me wearing the same thing, talking from my home, and you can react to me. So this is the future. I'll stop here and thank you very much.